Welcome to our webcast, Improving Health Equity Resources and Solutions, dedicated to sharing tools and resources across medical and healthcare organizations. I'm Barbara Lewis, and joining me today is Dr. Alice Fornari, who will discuss the anti-racism module funded by a generous grant from the Josiah Macy Jr. Foundation. Alice wrote the section of the module titled Diversity and Cultural Humility. Allison is an Associate Dean of Educational Skills Development at Zucker School of Medicine at Hofstra Northwell and Vice President of Faculty Development for Northwell Health, comprised of 23 hospitals. Her role aligns UME, GME, and the CME continuum. She is a Fellow of the Association of Medical Education of Europe, and she received the Distinguished Career Award for Excellence in Teaching and Educational Scholarship in 2021 from the International Association of Medical Science Educators. She was co-editor of the new IAMSE manual entitled Mentoring in Health Professions Education, Evidence-Based Strategies Across the Continuum. In 2022, she received the AAMC Northeast Group of Educational Affairs Outstanding Medical Educator Award and graduated from the Academy for Professionalism and Healthcare Leadership program in 2021. Welcome, Alice.
Thank you for that introduction.
So how did you get involved with the Josiah Macy Jr. Foundation grant to create an anti-racism module?
So I think it all started when I decided to do the LEAP Fellowship, which of course I highly recommend as an introduction to the Association of Professionalism in Healthcare that sponsors the LEAP Fellowship. And a colleague of mine, who was also part of the LEAP Fellowship, when we did it as a team. We had been working on an anti-racism curriculum at our medical school because we needed something for the students as well as the faculty. And we took this on, I would say, somewhat as a pandemic project, that we would create a curriculum for our medical students and our faculty to deal with the troubling topic of racism and the importance of educating people, both historically, what has influenced current times, and what was happening, and then, of course, what positive behaviors can we use to eradicate racism, if that's ever possible, and work towards more health equity and a better understanding of diversity, inclusion, and belonging.
So was your section, which was diversity and cultural humility, was that already something that you had researched as part of your work that you were doing?
So in developing our modules, my colleague and myself took a format that we use for another program I run at Northwell called Mentoring and Professionalism in Training, which was basically focused on mentoring, professional behavior, and it was interprofessional. And we took the model of that program and decided to develop a curriculum totally different than that program, but deliver it in the same format because that format had been very successful in our educational environment at Northwell. So I had already had the design of how to run it, but the content for our modules was different. So we did a lot of research for each of our modules. It was a year-long program. It had about 11 modules. The last module, the 12th, was sort of a wrap-up. And we had done all the work looking at the DEIB, literature, and working to really develop modules that had a thread of cultural humility and dealing with diversity, inclusion, and equity and belonging. So all of that was a thread through all our modules. I can't say we had a module just on that, but we had researched at that as a thread of all our modules.
Well, I'm curious now, you mentioned the format that you had. Can you tell us a little bit about what that format was? It sounds interesting.
Well, everybody in the program volunteers to be in the program. There was no mandate. It was, self-nomination or somebody nominating you. it's a once a month commitment, 90-minute curriculum, and you have 2 facilitators and about 6 to 8 people in a group. You meet with the same group and the same facilitators each month. And the only requirement is there's no pre-work and there's no post-work. So the only requirement is showing up. And that was very important for busy clinicians. Pre-work is a distraction that people say, I didn't do the pre-work, I'm not going to come, I don't want to do post-work. So the idea of just showing up and being present in the moment was key. And getting comfortable with your group. So since it was a year-long program, I'd say by month 3, people were really gelling as a group with the same 2 facilitators. Generally, the 2 facilitators as a goal were from different clinical professions. They weren't this, one might be a nurse and one might be a doctor, one might be a chaplain. And the groups were diverse because they were interprofessional, all clinicians. And there was a topic and a full curriculum with instructions on how to deliver it. And there was really very little technology in the delivery of it. That was very important to us. Not none, but minimal. And the group at the end was like, really a community and really felt connected. And I'm
sorry.
currently having a second tier of that program. It's only 6 months. It took me a while because people are like, we want more. So I'm in my second cohort of a second tier, still tweaking a sort of next level of that program. But the MAPIT program that focused on the topic we're talking about today was a separate curriculum that we offered first at the medical school to all the faculty at the medical school as our touch point. Then a group of students got together and they wanted that curriculum. So they have offered parts of it because the students don't have time for the whole curriculum. So bits and pieces of it. And then at Northwell, we've run some groups for clinicians, but it's been a little bit of a challenge at Northwell. So I would say that we're still tweaking how to deliver this at Northwell as a full 12-month curriculum.
And so the challenge is the duration?
Partly people say the duration. We need very, very trained facilitators in the groups to deliver the content because it's much more intense and emotionally charged than the content of my other program. So we have to be very careful who our facilitators are. So I would say the time is a limitation, the commitment to time, and the other is the quality of the facilitators and the training they require to be able to manage the emotions of a small group.
So besides the challenges that you faced, have you gotten feedback? And if so, what is the feedback about the program?
Everybody who does the program loves it, which
Oh.
is quite interesting. They find it intellectually enlightening, intellectually stimulating, a little intellectually scary also, I would say, because, oh my God, I can't believe I have not dealt with this before, the content on anti-racism. We called it anti-racism and allyship. So that whole idea of how do you be an ally? How do you upstand? How do you help people deal with microaggressions? How do you deal with stereotype threat, imposter syndrome? All those things are essential to understanding and having humility when you're working with cross-cultural groups.
So in case we have anybody who doesn't know what upstand is, could you tell us a little bit about that?
Well, the idea of upstanding is that if you see an aggression that is not appropriate or you feel is not appropriate, or it's a microaggression, a macroaggression, or a behavior, that you would be comfortable to upstand for that person who is not the aggressor, but the one who received it, and stand up for them as an ally and be able to help them through the negative interaction they had, but also help the person who was the aggressor understand perhaps how that behavior was not desirable and actually upsetting to the person it impacted. So you're an upstander, you're standing up for somebody very publicly.
And in the anti-racism module, we actually have snippets, quite a few of them, almost at the beginning of every section that we have, where Will Justice, who was a Black student at the time and is now a resident, talked about how the microaggressions that he had been thrown at him, which he says, and then he comments on the people who occasionally stood up for him and how he will never forget them, what an impact it made on him. So
So
that's
that's a
very
great
important.
example of exactly what we're talking about.
Mhm, mhm. So the subject of diversity and cultural humility seems rather large. How did you decide on what was going to go into this module or this section of the module, the anti-racism module?
Well, our audience had to be, we didn't know who our audience is actually, who's going to pick this up. We assume it's within the health professions world of people, either working or educating or clinicians. So we wanted some practicality to it as well. It can't, yes, there's theory, there's definitions, there's background literature, of course, but we also wanted some practicality of ways to manage diversity in the clinical environment, basically, which is where most of the audience lives, and then some practicality on how to actually demonstrate and behave in a culturally humility way. So a lot of things that happen in the clinical environment is from role modeling. So if I see somebody do something like upstanding or actually call out or call in, either way, you could do that, an aggression, and do it in a culturally sensitive way. Those are the practical tips that we want to give people on how to's bring this alive in the clinical setting, because it's not enough to have the cognitive knowledge sense. That is important. We know that. That's the foundation, but that cognitive knowledge is only good when it's in action and role modeling to other people. So if you think about cultural humility and the idea of going into a patient's room or working with a diverse group of learners, how do you understand how culture has to be addressed as a reality of the care environment? You can't ignore it and think everybody's of one culture. You will not have success in education or clinical practice. So I'd say a look at practicality was important as well.
So you mentioned a couple of words here that our audience may not know what they mean, and I'm wondering if you can talk a little bit more about them. It was call out and call in.
Right. So when you call somebody out, if you're in a group, you call somebody out and say, what were you saying? What does that mean? You're calling them out in front of everybody, versus calling in is more of inviting them into the group to say, I'm trying to understand what you're saying. I'm trying to clarify what I'm hearing. So it's more not calling them out to feel psychologically unsafe and feel that they're being, quote, reprimanded, right? But calling them into the group to get them to understand the repercussions of what they're doing. So it's this calling, when do you call out and when do you call in? Obviously, calling in is, would you say it's a more gentle behavior, or it's certainly a more sensitive behavior? But it
Well, then,
takes a skill to do that.
right. Yes. And practice, as you're saying, role modeling is
Yes,
probably important too, or
right,
role playing as well.
definitely.
So would you ever use call out, which is a little bit more maybe
Uh,
disruptive than call in?
I think it would depend on the severity of the situation. Um, I think call in takes a little more time. So if it was something really detrimental to a patient or a learner, um, you might have to do call out, but realize the repercussions of call out could be, you might need to do some first aid or band-aiding afterwards. If this person is going to be part of your team or a colleague, if you called them out, let's say a call out would be, well, I think you're really a racist. And somebody says, I don't know why you're saying that. Well, look at what you just did. I don't think that's racist. I mean, there's a lot of repair that would have to go if you're continuing to work with that person or whatever you're doing with them or supervise their patient care versus let's discuss, how those words imply that maybe you're uncomfortable with this population. That's a much different approach.
Definitely. Why do you think that the anti-racism module is important?
So there's a few reasons. One is history is forgotten. And when you speak to our young learners today across any of the health professions, education, most people, I don't even think, feel connected to, let's say, Martin Luther King. I mean, that was the 1960s. I had the great advantage just maybe 3 years ago at this point of doing a historical tour of the South, a guided tour with an expert, a guide. And I went from Atlanta, where the birthplace of Martin Luther King, to Memphis, the death place of Martin Luther King. And in between, Alabama, Louisiana, Tennessee ended up. The history in that tour, that was 5 days on a bus, taught me things I lived in the 60s, but I either forgot or never knew. And the reality of the history of what happened in the South, the fact that there's a lynching museum because of the level of lynching that happened in the African American community or historically Black community, was devastating to me, that there was enough terror to make a lynching museum that exists. And I feel everybody in the United States should see that museum. So I feel the history is evaporating, if not already evaporated. And of course, we're reliving some of that history again, but people don't realize we're reliving it, some of the young people who never experienced, the historical piece. So, it's very hard to present history to young people because they feel like we're just telling them about the past and they want to be in the present. So the key thing is not just the history as important in the modules, but then bringing it to the present. So either to patient care or clinical teams that are running, to understand how behaviors that support racism and don't promote anti-racism and allyship will be detrimental to the care outcomes and the clinical outcomes of teams. So I think history is one piece, but current application and understanding how things are being replayed in society today are important parts of the curriculum.
That sounds like a fascinating tour.
Yeah, amazing.
So the free anti-racism module does just that. It takes the historical perspective of things that happened and threads it to then present case and what's happening in the clinic today.
Mhm. Yes, so that's very important.
So you were surprised on your tour of what you saw. Was there anything that surprised you about your research that you did on diversity and cultural humility?
I think the level of lack of humanism during the days of slavery were not front and center in my mind. I knew about it, yes. I've been to the South even before this. I went to a plantation when I was in Nashville once and understood about plantation life a little bit. But the lack of humanism, and we still have that today, so it's really still present, it hasn't left us. But thinking about that particular group of slaves, and that really sticks with me as a historical perspective that I felt I've relived more lately in the anti-racism curriculum development, the delivery of it, as well as some personal enrichment that I've done.
Mhm. Is there anything that you would like to add to this conversation before we wrap up?
I just think that I happen to live in New York. And I think that in many ways is a blessing. Living on the two coasts, I think, is a blessing. Because I just think parts of the middle part of our country and the southern end of our country still has a lot of characteristics that reflect the history, and how do we work towards bringing some of the importance of leaving that history behind and doing things in a different way as universal to our country. So as I say, I feel very safe where I am, but I don't think I'd feel as safe going elsewhere
Mhm.
at times. And I'm not a person who is fearful. I like to take risks, but at the same time, I have to understand that there are many people who don't want to know that we have a history and that the history can continue and be detrimental.
Thank you so much, Alice. I really appreciate it. You've been listening to Alice Fornari talking about the anti-racism module section that she wrote on diversity and cultural humility on our webcast, Improving Health Equity, Resources and Solutions. I'm Barbara Lewis. Thank you for listening.
Oh, Barbara.